Welcome to Burst TV. My name is Amanda. I am a dental hygienist and Burst ambassador. And on today's segment, I am joined by some amazing women, and we are going to be talking about working while pregnant. So pregnancy, it is such an exciting time full of life-changing moments. But there are also some challenges as well. And we are going to be discussing those challenges today to hopefully help other dental professionals get through them a little bit easier. So before we get started, if you guys wouldn't mind sharing a little bit about yourselves, maybe what position you hold, where you're located, how many kiddos you have, or any other fun facts you'd like to share.
My name is Christina. I am a registered dental hygienist and a Burst ambassador. I have been a hygienist for 11 years, and I have one son, and he will be 2 next month. And I am in Texas.
I'm Paige, and I'm located in Tennessee, in East Tennessee. I have 2 little boys. One's 5, just turned 5, and one is 14 months. And I'm a pediatric dentist, and I own my own office. So I have 2 associates with me, but we have a lot of fun.
Hi, everyone. My name is Majadi. I am actually the HR and recruiting coordinator here at Burst, and I'm located in Texas, mama of 4 and 1 on the way. So I have the 15-year-old, have 7, 4, and 5, and then, like I mentioned, 1 on the way in June.
As you guys know, we often have advice for our patients when it comes to the do's and don'ts of pregnancy. Dietary suggestions, importance of brushing and flossing, when to see the dentist. But what about us, the caregivers working on patients? Majadi, this question is for you. Some might fear being treated differently or losing their position. When is the best time to tell your employer that you're pregnant?
Obviously, those concerns are definitely valid for sure. It's a nerve-wracking time. But as far as when you should tell your employer, it's definitely going to be whenever you feel comfortable to do so. All of us being moms, we know that the first trimester is definitely a whirlwind, I guess you could say. Anything could happen during that time. You can have a lot of morning sickness or whatever the case may be. And so normally after that first trimester, people are feeling a little bit better and can, communicate those things to the employer, but definitely it's going to be whenever you feel comfortable doing so.
And during this conversation, is there any questions that you should ask your employer?
Yeah. So, just regarding actual pregnancy leave. So you want to ask those questions, what type of leaves are available to you? And then also as far as income protection, making sure you have those benefits to be able to protect your pay. And, even it may be questions about who's going to take over some of the work that I'm doing during the time that you're out. So those are definitely probably the top 3 questions that I would say a individual should ask their employer.
Paige, I would love to get your perspective as a business owner. How did you go about this for announcing your pregnancy or your employees?
So I didn't own the office when I had my first, but my second, I waited 12 weeks to tell everyone. They already knew because they just know. I think it's hard to keep it a secret in the dental office full of women, but they already knew. But like all my girls, when they get pregnant, they tell me. They come and tell me when they get their pregnancy test because they know I want 8 babies, and I'm so happy for people when they have babies. So my office manager, not so much. She's usually like, stop having babies. So they come tell me, and then they kind of line out all the details with her. But we do try to offer like the maternity leave. We let them use their time, and I always try to make sure they're comfortable with like what they're doing, and I always check in on them because I know it's rough. So we really coddle the pregnant people because I know how it is to be pregnant and work. So I always make sure that they're supported for sure.
That's really great to have so much like positive support because
Yeah.
not every practice is like
No.
that. How about you,
No.
Christina? When did you announce that you were expecting?
I did very early on. I think I was 6 weeks when I told my employer, just because there's things that you are concerned about, when it comes to taking x-rays or monitoring nitrous oxide. So I was very forward and was like, this is happening. This is what's going on. What do you expect from me? And, I let them kind of know what I was comfortable with and what I wasn't.
Majadi, when did you announce for your, let's just say your most recent?
I was probably closer to 5 months just because I'm working remotely and it just kind of, gets away from you sometimes. But definitely when I did announce it to my supervisor, it was kind of like a congratulations. Oh my gosh, this is number 5. This is so exciting kind of thing. So definitely positive vibes for sure.
Love to hear all the positivity because my boss the second time. Oh, again? Okay. I think working for men is a little bit different.
Definitely.
Yes.
So by show of hands, who had the lovely symptom of morning sickness?
I definitely.
Oh, just
morning sickness? That's amazing.
Did not have any morning sickness. I would get nauseous like midday, but I never had any morning sickness at all. I don't know why, but it was perfect.
That's amazing.
Oh, so blessed.
Yeah.
Yes.
I was in residency when I had my first baby, and I literally would leave early so I could stop my car and open the door and throw up on my door.
Oh
It
no.
was always so bad. I ended up bringing a doggy bag with me. It was really bad. So had awful
Paige,
mornings.
do you have any tips for helping managing morning sickness at all that you could share?
It always helped me to like get up earlier because I felt like if I got up, like I'm like a really rushed person in the mornings. And if I felt like I woke up and kind of gave myself a little bit of time to like be sick and then get ready, that it kind of like buffered it a little bit. And then I avoid like anything greasy or anything like super strong. In the morning, I just did like water and not too much water. It really just, and I still didn't really make it work too well, but they would buy me those little pops that I guess the ginger pops and all
The
that.
ginger pops, yeah.
Those are good. And they helped me a little bit. And I did drink a lot of ginger ale, and I hate ginger ale. So
For my morning sickness, it was like every morning from the minute I found out I was pregnant until probably about like 20 weeks. It was pretty bad. I would try to start my morning a little bit earlier, sit there a minute. I'd either get sick or I wouldn't. I just felt like I would. So then I would go about my brushing my teeth, eating breakfast, all of those things. I had the good ways of handling it, which was when I got on vitamin B6, which was recommended by my midwife to help with nausea. And then I would use lemon oil on my back of my ears and my neck. Something about the citrus smell really kind of helped advert the senses. But then I also had a really bad thing that I would do. So dental professionals, cover your ears. I sucked on Sour Patch Kids in the morning on my way to work. Something about the sourness helped like level out the sour feeling in my stomach. And then I would just chug and swish lots of water when I got to work, and it would at least get me through the day.
my mother-in-law bought me a water bottle that had like the times on it, which was really nice. So like when I would be between patients and it would say like 11 o'clock and it was like 11 and I hadn't even drank any water, I knew I had like gulp it down before I went back to some patients.
Chug to here.
It was a good guideline.
And obviously, too, with our growing bodies, practicing with proper ergonomics becomes super difficult. Does anybody have any good advice for kind of minimizing your back, neck, or hand discomfort? Being bent over patients for long periods of time.
I always seem to do very well with at least going to the chiropractor every once in a while. Getting that, good alignment was always kind of great for me. I know that you all are kind of working in the office, we're working with patients from the remote perspective. Getting a standing desk was probably one of the best things that I could have ever done for myself. So definitely, I would say chiropractor number 1 for sure.
Yeah, I did massages as well, prenatal massages, and I saw the chiropractor. In the chair, I think the biggest thing, loops with a light on it helped. And I did actually stand for some patients, kind of depending on how I was feeling. I had really bad sciatica starting very early. And so sitting all day long could be tough, especially as I got bigger. And I feel like patients are pretty understanding with it. They always tell you in school, move your patient, not yourself. And I'm terrible at that. I always will move myself instead of my patient. But during pregnancy, that was one thing that I focused on, was moving my patient to where I needed them to be for my comfort. So
what about you, Paige? Any suggestions on just keeping everything comfortable?
I just put my feet up a lot. Like, I didn't get much swelling, but it just felt nice to just sit in my office for a second. I don't really get much time to do that because we see quite a few patients a day, but anytime I had a cancellation or like had a break in hygiene, I would just go prop my feet up and just sit there for a little bit in my office by myself.
I would have to definitely agree. I did a lot of standing, especially towards the end. I had very large babies, so I couldn't reach anybody. And compression socks, they saved my ankles
And help a
because
lot
if
of
I
people.
worked without them, by the end of the day, I had no ankles. They were gone.
I did compression socks as well. I did.
Actually, my first, I had to get prescription strength. So the doctor actually wrote out, and I had to go to Benson's, people get their medical equipment to get my socks, which was interesting. And my husband had to help me put them on towards the end because I couldn't reach. So we'll move on to Paige. This question is for you. So when it comes to taking x-rays, is there any changes that you would recommend changing for protocols?
For me, I wasn't super comfortable taking x-rays when I was pregnant. So we do like sedation office and we do have a nomad. And I would like step out of the room. That was the girl's first indication that I was pregnant, is I started to step out of the room. And anytime any of the girls at work are pregnant or anything like that, I do think they should try to stay away from x-rays, even the nomad, even though I know it's like a focused beam. But we try to take all the precautions, the nitrous and the x-rays. I use nitrous my whole pregnancy, but I have a couple girls who weren't comfortable with it, and I supported it and kind of switched them somewhere else.
Yeah, I know personally I wasn't comfortable with doing the nitrous on my patients. I think I didn't believe we had like that good scavenger system.
Yeah,
So I was like, I don't
we
think I
kind of
want to be in
installed
the
all
room for
ours and
that.
checked it because like nitrous, it can't cause any birth defects, but it can cause spontaneous abortion. So that was like a really big concern. Um, and so usually, they use it to induce pregnant ladies all the time when they get further along in pregnancy. So for me, I kind of went onto like a pediatric dentist forum and kind of got some advice from other like moms, and I would say 90% of them were using nitrous during pregnancy. So that's why I just decided to try it, because in a pediatric office, we use it on almost every kid. So it was hard
Right.
to like just halt for 9 months.
Yeah.
I obviously put my child first, and I was a paranoid patsy pregnant lady, but I did use the nitrous, and I wore double masks, and I made sure the scavenger was on all the time.
And as far as like the chemicals that we used for disinfecting the operatories or, instruments, any protocols that you have for that in the office?
So when they're pregnant, they do the spray wipe spray like you're supposed to do in the office, but it smells really strong in those little operatories. The hygiene bays aren't as bad because we have open bays, but I won't let any pregnant girls do it in the operatories because I just don't want them, breathing in fumes. Um, but I do kind of leave it up to them on how they want to handle their own pregnancy, like, because I kind of did that myself, but I do. They're all a young bunch of girls, so I sometimes think they're not really too paranoid about anything. So I always make sure to like kind of mother them and be like, "Don't breathe these fumes. Watch out for your X-ray exposure. Watch out for the nitrous and all that."
It's good to have somebody looking out for you.
Yes, I
Sometimes
try
people just
to.
don't really think about all of those things.
Yeah,
So.
exactly.
Jody, what was your experience like going to get your dental cleaning when you were pregnant?
Yeah, so it was definitely a good experience, I would say. Obviously, they're making sure that everything is looking good, focus more on the actual cleaning itself. I would say it's probably funnier when I take my younger kids to actually go get cleanings and they see my belly and they have to get x-rays and stuff that like that. And so they're like, can you stand over here to the side? We want to make sure we don't interfere with anything. So for myself, I would say pretty normal, definitely didn't feel like I was being treated any kind of way. Felt like I was being coddled in a sense. And then with the little kids, just, making sure that I'm not involved as far as the x-rays and nitrous and things like that.
The biggest thing that I saw, I mean, even on myself, was, bleeding gums, a little bit of inflammation. I don't feel like I had it as bad as I've seen with some of my patients, but my big thing was my water flosser. It was the one thing, even with the inflammation, the bleeding, that felt like it was still soothing my gums and it wasn't too painful.
That's one thing I wish I had during my pregnancies was a water flosser. I don't know why I didn't have one yet, but I
didn't
did
have
not.
one either, and I just recently got a burst water flosser in the last year, and I'm like, this would have saved my pregnancy, like, so much stress.
Yes.
What about you, Majadi? Do you use your water flosser right now?
Yes, every day, every day. Normally, in the morning, I'll use the expanding floss, which I love, and then usually at night before I go to bed, I use the water flosser. So, kind of have a combination of the both going on.
And then next topic, taking time off of work. So in 1993, the U.S. passed the Family and Medical Leave Act, granting certain categories of women and men up to 12 weeks of unpaid protected leave. Majadi, has this evolved over the past 10 years or so?
So I would say it's evolved some, right? So now, as far as FMLA goes, there are certain requirements that you actually have to meet, and some folks don't realize that. You have to have worked for your company for at least a year. You have to have had at least so many working hours within that year to be able to qualify to use FMLA. But aside from that, a lot of companies nowadays are seeing that this is a bonus that employees are looking for, especially when they're looking for new jobs. And so a lot of people have updated their leave policies within their handbooks, added in some different types of medical leave or specific paid paternal leaves. And so those changes are definitely moving along with the new ages. There's some discrimination acts that have been implemented as well. So you can't discriminate against pregnant people. And so definitely some changes moving in the right direction for sure.
Good. And can you tell us how much time a first employee has off?
Yeah, so at first, it's always one of my favorite things to chat with, just regarding benefits with new employees. So at first, we do have paid paternal leave for 8 weeks. So our employees are able to take that time off, moms or dads, and utilize that time to bond with baby. And then obviously after that, if they need any type of accommodations before coming back, or maybe they need to extend it a little bit, we are pretty flexible with that as well.
Christina, how much time were you able to take off during your pregnancy leave?
So I did kind of fall into, with the FMLA, I had only worked 11 months with my company. So I was still offered the 12 weeks, but it was unpaid. And I actually chose not to go back. And I told them pretty early on. So I'm actually still at home with my little one, looking into possibly going back part-time here very soon. But yes, I was offered the 12 weeks, kind of guaranteed unpaid time off.
And Paige, what about you? How much time did you take off for your leave?
For when I was a practice owner, I took 8 weeks, and I took 13 weeks in residency. It was really nice. I don't know how I did that, but I did. But the 8 weeks, it felt like a pretty good amount of time, and it felt like I was gone from the office for a while. But my associate picked up all my slack, and she worked extra days for me, so it was pretty seamless and nice.
Did you have any pay, or were you able to take like sick pay or vacation time?
So we let the girls take their sick pay and their PTO, and then we give them some time too. And as for me, I actually co-own with my brother and another one of my relatives. So they honored my pay and let me just take my paychecks the same as. So they were really great about it.
That is so nice to have.
Yeah, for sure.
Personally, I took with both of my girls, I took 10 weeks unpaid leave. So it's a little hard, but we for both babies, we knew that was something that we were going to be doing. So we just saved every penny we could. So we knew for those, couple of months that we would be covered.
Yeah, as a like a business owner, it is hard to give people like if you're not like if you're just like a small kind of office, like not like a corporation, it is really hard to give like paid time off for, 8 or 10 weeks. We try to do as much as we can, but from a pregnant person's perspective, it is really hard because, you already stressing about a new life and then you have to worry about like no income coming in from your part. So I can definitely see it from both sides as a stress either way.
So, as we wrap up today's discussion, if each of you could share a piece of advice or a tip that you wish you would have known about working while pregnant.
Mine is like preparing yourself for mom brain because like I didn't and I was so cloudy. So if I wish like, my second pregnancy I got a calendar that combined like my personal and my work life and I like put it all on this huge desk calendar so I could kind of keep up with my life because I just felt like I was in this huge fog and I can't remember what conversations I had or anything really. So it helped me a ton to do that the second pregnancy.
Lots of notes.
Lots of notes, yes.
One thing that I would just suggest is when people are willing to help, accept the help. I would always feel like I still needed to be, independent, doing all my things on my own and not relying on other people because I didn't want people to look at like my pregnancy as being a disability or making it to where I couldn't still do my job. But I got to a place kind of closer to the end where I would start to accept help, but understanding that, a lot of us, our dental field is women and a lot of us are moms and they've been through it or, they understand it. And so they're not helping or asking to help you to, be a crutch or make you feel bad. They're trying to help you because they've been there and they probably could have used the help themselves.
That's great. Everybody, we need to support each other during that
Yes.
time. It's hard.
It is.
And so I would say the biggest thing that even this pregnancy, this time around, I have kind of taken advantage of when I'm not working and busy with kids is taking a nap. I feel like, sometimes you just really need rest. We're growing an entire human being in our body and it takes a lot of energy out. And so, when you need a nap, take a nap.
Really, really great suggestions from everybody. I have to say, I completely agree with, getting help when you need it. I know in my office, I've been there the longest out of everybody. So I've been there 13 years and I wear all the hats. And when it came to my pregnancy, I knew I had to take most of them off and just wear the hygienist hat and take care of just my patients and myself and get through the day. All right. Well, thank you, ladies, so much for joining me today and sharing your pregnancy advice. For those of you watching, if you like this video, please give us a thumbs up and be sure to subscribe to Burst TV for all your dental related content. If you have any questions regarding today's segment, drop them in the comment section. And thanks for watching.